Welcome, well, Dr. Francis Faduyile, as you see in that welcome slide, joins us this morning. He's the chairman of the NMA Lagos chapter. Morning, and thank you for coming on today.
Thank you very much. Good morning.
Well, we'll be talking about the doctor strike, and let's find out. We will find out whether or not we're going to sort that out, or do we still have to wait for more meetings? What's the federal government doing? But let's remind you of what some of these issues are with the NMA with this report.
This meeting of the Nigerian Medical Association that met last Saturday has directed all doctors in the country to down tools as from 0010 hours of the 1st of July 2014.
The ripple effect of this directive by the president of the Nigerian Medical Association, Dr. Kayode Obembe, is now being felt in public hospitals in most parts of Nigeria. From the north-central states of Kogi and Niger to the National Hospital in Abuja, patients seeking medical services in government hospitals are either receiving skeletal services or are being outrightly turned back.
To my greatest surprise, there was somebody who said he's a HOD, though I did not know his name, said he will just come and let us know that we should just go, that doctors are on strike. So we are just here.
The moment of issue has met, we also resolved that we put all machineries in place to make sure that our patients in the wards are well taken care of. And so we might not admit new patients, but we also attend to emergency cases in National Hospital.
Moving down to Ogun State, precisely at the Federal Medical Center Idiaba in Abeokuta, the strike action has paralyzed activities. Here at the General Hospital Bagada in Lagos, southwest Nigeria, the patients are left in the hands of nurses and a few consultants on duty. The nurses here at the emergency room are doing what they can to salvage the situation, while other patients wear long faces, not knowing when it will be their turn. For now, they have to wait while the doctors sort out their 24-point demands with the federal government. Top 5 issues the doctors want addressed immediately include the appointment of Deputy Chairman, Medical Advisory Committee, DMARCs, for teaching hospitals and federal medical centers. The doctors are opposed to the appointment of directors in the hospitals. These, they say, will distort the chain of command. The NMA demands that grade level 12 in the health sector must be skipped for medical doctors. The NMA also declared with emphasis that if non-doctor consultants are appointed, it will lead to chaos in the health sector, and so this should not happen. The association said relativity in the health sector is also sacrosanct, demanding the immediate implementation of the January 3, 2014 circular.
Strikes here and there, most times it's either for getting increments in their pay. But unfortunately, I heard the issue is not even that now. It's like an administrative issue. Why now? Why now when everybody should join hands to see how they can save the lives of people? Why is this a time we want to start losing people? We have people in the hospital, we have children, we have women, waiting for them to care for them. This is not the time.
For me, strike for medicals, hospital, and it's not good because these are people that are on essential duty, to save lives.
I wouldn't say they shouldn't go on strike because what they are fighting for, there must be something.
It's the patients and their family members that are at the receiving end of a seeming superiority tussle in the health sector. Everyone is looking in the direction of the federal government, represented here by the Federal Ministry of Health and the striking doctors.
Welcome back. Well, a lot has since happened ever since then, including comments from the Federal Ministry of Health, the minister, as a matter of fact, speaking up on this matter. But let's find out from Dr. Faduyile, what's going on with this? We understand that the NEC of NMA met some time ago. What happened thereafter?
Well, thank you very much. It's true that the emergency delegate meeting of the NMA met last week, Monday.
this week Monday, and we had about 8-hour meeting where we look at what the government has put in place in trying to resolve the issues. And what we have found out is that the government has not in any way shifted ground. The government has not shown that sincerity of resolving the issues at hand. Unfortunately, from what we have seen broadcasted, the presenters narrowed it to 5 major things, where sincerely it's not as if other things are not major. I must first of all congratulate the House of Representatives. Within 5 days of the strike, they were able to go ahead and pass the National Health Bill. It's part of, if you remember, some time ago, doctors were on street. We went to the House of Representatives to do lobbying so that we can have that health bill. It's part of the demand, and that one has been done, and that is what we are looking for. But other issues. Yeah,
but you know, there's a comment too from the minister. I'm sure you must have heard, where he said that, look, he said, as a matter of, he says that the basis of continuing with the strike is unfounded, given that most of the issues have been addressed squarely. Okay. He also says that there's a signed MOU which was to have been apprehend a nationwide strike, but that was jettisoned by the NMA before you proceeded on that strike. He says most of what you're asking for could either be sorted out administratively.
Yes, certainly. If we see that concern, let me explain to you. For instance, the issue of directors. It's not as if doctors is opposed to anybody having directors. But in the hospital, having 22, 30, 40 directors has nothing to do to improve patient care. Doctors say, look, if you must give this large number of directors in a hospital, why don't put them in the ministry, where they can work effectively to push file or to do their other duties. And the minister has come out and said that the edict that funded the Federal Teaching Hospital states that you should have 3 directors: the Chief Medical Director, the Director of Clinical Service and Training, and the Director of Administration. That edit or that act is the law. And now we have had several places in which we have 4, 5, 6, 7 directors. What is the ministry doing about that? For you to say you are following that act, you should have either chastised those that have been appointed, tell them that this is not within the purview and these are things you have to do. For the issue of deputy CMAC, they have actually circularized it, that each federal institution can have up to 3 deputy CMACs, and those federal medical centers that are smaller can have up to 2. We have had cases in which we have 5, 6, 7, 8, 9 deputy CMACs appointed. What is the ministry doing about it? And he said, look, we have resolved it, it's administrative. And we are seeing this robbery, this rape of this our law. Where we have a law, we should follow it. The case of consultant, it is stated in the scheme of service that a consultant is a medical doctor, MBBS or BDS, who had further had specialist training, a fellowship of National Postgraduate Medical College or its equivalent. That is the people that can be appointed as a consultant. And you have people who do not have the MBBS or BDS degree being appointed. What is the ministry doing about it? He is saying, look, there is a court case. They went to industrial court. Certainly the court, the court is in its own wisdom has decided to give some of those relief, and they claim that they are appealing it. Okay, good enough. Don't talk about that, but let the ministry state spell out so that everybody knows who can be appointed a consultant. These are the things that we want the ministry and the minister to put in place. It's not just for the minister to come and say, we have resolved all the issues, it is an administrative thing, then we should not go on.